A quorum is present. The committee meets today pursuant to notice to consider H.R. 4509, the Transparency in Billing Act, H.R. 4507, the Transparency in Coverage Act, H.R. 4527, the Health Data Act, and H.R. 4508, the Hidden Fee Disclosure Act. Chair announces that requests for recorded votes as to amendments may be rolled pursuant to Clause 2 of Rule 11 of the Rules of the House of Representatives and Committee Rule 14B. Without objection, the chair may recess the committee at any point. I now recognize myself to make an opening statement. Today's markup builds upon the committee's long-standing work to improve transparency and competition in the U.S. healthcare system so workers and their families have more options at lower prices. This markup is the committee's culmination of a process beginning at the onset of the 116th Congress, as members on both sides of the aisle came together to forge a solution to the growing problem of unexpected bills from out-of-network providers known as, quote, surprise, end quote, medical bills. After 2 years of committee deliberations, the No Surprises Act was born. It was enacted as part of the Consolidated Appropriations Act of 2021, but the path to implementation has yet to be paved. The Trump and then subsequent Biden administrations assumed the task of ensuring guidance surrounding the No Surprises Act matched the letter of the law and congressional intent. Now, after over 2 years of congressional oversight of the law's implementation, we have a good idea where we can offer help. Today's markup isn't taking a chisel to the law, it's using a fine brush to remove the excess dust and reveal the work underneath. The four bills before us today, the Transparency in Billing Act, H.R. 4509, Hidden Fee Disclosure Act, H.R. 4508, Transparency in Coverage Act, H.R. 4507, and H.R. 4527, the Health Data Act, all better equip the administration to carry out the intention of the No Surprises Act. The first bill before us today, the Transparency in Billing Act, ensures hospitals account for their charges correctly and prevents them from tacking on hidden facilities fees and upcharges. It forces them to have in place policies and procedures to ensure accurate billing practices. In what other business can a company legally charge you for a fee going to a facility you never visited? This is like a rental car company charging an airport fee when you pick up the car 30 miles away from the airport in your local neighborhood. This committee has a duty to ensure that hospitals are holding up their end of the bargain when working with commercial plans, accurately charging and not price gouging workers. The Transparency in Billing Act does just that. Therefore, I support passage of H.R. 4509. Next is the Hidden Fee Disclosure Act. Enacting the No Surprises Act in 2020 did more than address surprise billing practices. It ensured patients had access to transparent cost data before undergoing medical treatment, so they can then shop around and choose the best option. The Hidden Fee Disclosure Act clarifies the law's requirement that, quote, consultants, end quote, disclose compensation received for their services to group health plans. Though plainly written to encompass pharmacy benefit managers, PBMs, under the, quote, consultant, end quote, umbrella, the law has failed to guarantee compliance from PBMs. PBM compensation is a blind spot for the American public. We know they leverage their market power to extract rebates from drug makers. We know they leverage their relationship with health insurers to decide which drugs should be covered. So we have a right to know if they do so in an unfair way to the consumer. H.R. 4508 ensures PBMs are not above the law, and I urge its passage. The third bill before us today is H.R. 4527, the Health Data Act. This bill should be the final answer to a problem we attempted to solve with the No Surprises Act. The No Surprises Act amended Section 724 of the underlying law in an attempt to ensure that health plan insurers and service providers were not contractually prevented by gag clauses from accessing payment and high-quality information about their own health plans. It did not achieve the intended goal, though, as service providers continue to block health plans from accessing cost data that will allow them to ensure that employers are meeting their fiduciary duty to provide the best health coverage at the lowest cost. These barriers will continue to exist if Congress does not rectify Section 724's legal loopholes. Therefore, I urge passage of the Health Data Act. The last bill on the agenda today is the Transparency and Coverage Act. This bill would codify the Trump-era transparency and coverage rule, which has largely been upheld under the Biden administration. While this bill does not directly address a hole Congress has discovered following the No Surprises Act passage, it does build on the general principles of transparency and accountability enshrined by the law. It requires health care plans to release negotiated rates and cost-sharing estimates publicly. With these tools made widely available, Americans will save millions on health care, and they already have. The bipartisan-supported Transparency and Coverage Rule is a resounding success, which is all the more reason to codify it into law. The final portion of the Transparency and Coverage Act asks from PBMs what it asks of health plans: transparency. It would give Americans a peek behind the curtain into the true cost of prescription drugs and the insider deal-making between drug makers and PBMs. H.R. 4507 will empower patients with transparent information they need, and I urge its passage. With that, I look forward to debating and discussing these four important bipartisan health care transparency bills, and I yield to the ranking member for his opening remarks.
Thank you, Dr. Foxx. And the bills we're considering today take promising steps to lower health care costs for workers and families by promoting transparency and competition in health care. One of the key problems behind the high costs of health care is that consumers and employers do not have complete information about the care for which they are paying. This makes it harder for patients to find affordable, high-quality health care, high-quality health care provider, and it also prevents employers from spending the workers' premium dollars carefully. It hinders competition, which keeps health care costs in check for consumers and employers, and it limits our ability as policymakers to improve the health care system. While we've made bipartisan progress in the past two Congresses to address this issue, we know that more can be done. For example, the pharmacy benefit managers, or PBMs, and third-party administrators often fail to disclose their fees to plan fiduciaries, and they prevent plan fiduciaries from using this information to lower costs or improve quality. Employers and consumers also often do not know how the rebates that PBMs receive from drug manufacturers impact decisions that raise the costs for workers and families. In response, the Transparency and Coverage Act, led by Health Subcommittee Chairman Good and Ranking Member DeSaulnier, improves current regulations that require group health plans and insurance providers to release key details such as prescriptive drug pricing and cost-sharing information, and it ensures that this information is both accessible and useful for the public. Moreover, it requires PBMs to regularly inform plan administrators about the rebates they receive from third parties and compensation they pay to consultants and brokers. The next bill under consideration, the Transparency in Billing Act, makes key reforms to improve transparency in hospital billing. We're seeing a growing trend of hospitals acquiring independent physician offices, then charging patients higher prices, even if the care they receive is essentially identical to what they were receiving before the hospitals acquired the office. This legislation prohibits hospitals from billing consumers their private health plans unless they provide sufficient information to allow payers to determine the site in which the care was provided. Third bill, the Hidden Fee Disclosure Act, introduced by Representative Courtney and Representative Huchin, promotes transparency in service providers, including brokers, third-party administrators, and PBMs that contract with group health plans. Despite the clear requirement under current law that these companies disclose their fees, many fail to do so. Or if they do, they make it virtually impossible for fiduciaries to identify whether the compensation paid is reasonable and whether vendors receive indirect compensation that could present a conflict of interest. Similarly, other transparency measures that apply to third-party administrators and other service providers have not functioned as intended. In the final bill we're marking up, the Health Data Accessibility, Transparency, and Affordability Act strengthens one such requirement, which is the prohibition on gag clauses enacted on a bipartisan basis through the Consolidated Appropriations Act of 2021. This bill, introduced by Representative Chavez de Remer and Representatives Takano and Manning, improves enforcement of the gag clause prohibition and ensures that plan fiduciaries can audit cost data produced by companies that administer their group health plans. Simply put, the American people deserve to know the full pictures of the prices they're asked to pay. And I thank my colleagues on both sides of the aisle for leading these proposals that will help ensure that healthcare costs are driven by those who provide the highest quality services, not by those who have the most market power. So I'm hopeful that our bipartisan work continues after today's markup to make our healthcare system work for patients and families. The American people are counting on us not only to promote transparency and competition, but to take direct action to provide access to affordable, high-quality health care for all. Thank you, Madam Chair, and I yield back.
Thank you, Mr. Scott. Without objection, all other members who wish to insert written opening statements into the record may do so by submitting them to the committee clerk electronically by the end of the day today. House rules require that a copy of the measure be made available to members and the public at least 24 hours in advance. Pursuant to the notice for today's meeting, a copy of the measures was made available to members and the public at least 24 hours in advance. Each bill being marked up today shall be open to amendment at any point, and the chair will allow members to offer amendments in a manner not prohibited by House or committee rules. Without objection, members who have more than one amendment to a bill and wish to offer their amendments en bloc may do so. The committee will now proceed to the consideration of the bill H.R. 4509 for amendment. The bill was circulated in advance and printed copies are available. The clerk shall designate the bill.
H.R. 4509 to amend the Employee Retirement Income Security Act of 1974 to require group health plans and health insurance issuers offering group health insurance coverage to only pay claims submitted by hospitals that have in-place policies and procedures to ensure accurate billing practices and for other purposes.
Without objection, the first reading of the bill is dispensed with. Without objection, the bill will be considered as read and open for amendment at any point, and any amendment offered shall be considered as read. I now recognize Congressman Bean to offer an amendment in the nature of a substitute. The clerk shall designate the amendment in the nature of a substitute.
Amendment in the nature of a substitute to H.R. 4509 offered by Mr. Bean of Florida, identifier billing-CONT-02_ANS.
Without objection, the amendment shall be considered original text for purposes of further amendment. The amendment in the nature of a substitute has already been distributed. I now recognize Congressman Bean for 5 minutes to explain the amendment in the nature of a substitute.
Thank you very much, Madam Chair, and good morning to you, and good morning, Education and Workforce Committee. I am pleased to offer this amendment in the nature of a substitute to amend H.R. 4509, amending the Employee Retirement Income Security Act of 1974, ERISA, to ensure accurate billing practices by hospitals. This bill is a critical step towards protecting our constituents and ensuring that Americans only pay for appropriately billed for services. This committee, Madam Chair, I don't need to remind you, this committee has heard numerous concerns about the rising cost of health care for years. During the 116th Congress, the Health, Employment, Labor, and Pensions Subcommittee, or HELP, held a hearing on surprise billing, highlighting the lack of transparency in hospital bills and resulting financial burdens on patients. Witnesses, including industry experts and policy analysts, testified about the need for reform. Reform may just happen today with the passage of this amendment. This testimony that back in the day provided the impetus for this amendment today. During the 117th and 118th Congresses, the HELP Subcommittee built the case for improved hospital billing practices with subsequent hearings. Discussions, expert testimony focused on reducing costs for working Americans and their families by promoting, how about this, competition and transparency. Those are the key ingredients to having a vibrant healthcare market. Time and time again, we've heard about the financial consequences of dishonest billing practice. Misleading, inaccurate billing by hospitals has undoubtedly contributed to rising health costs, and with hospital prices accounting for 1/3 of healthcare spending in the United States. Medicare's payment system, which pays for services provided in hospital outpatient departments than in other settings, has everybody's paying more. That's what we're doing, where everybody's paying more, and we're hoping to rein those in today. The Transparency in Billing Act is the culmination of years of work and a response to these changing hospital pricing, provider consolidation, and skyrocketing costs. By requiring hospitals to have policies and procedures in place for accurate billing, we can ensure no American lives in fear of his or her medical bill. I hope this bill receives the bipartisan support it deserves today, and we take one more step towards reducing the costs in the American healthcare system. We've all been to what we think is a hospital, and we know when we're in the hospital. But when we visit a doctor's office or an urgent care or somewhere else, we think we're not in the hospital, but yet we're billed as if we were. This amendment will hopefully ensure accurate billing so that no one pays more than they should, and everybody clearly understands what they're being billed for. With that, Madam Chair, I support the passage of the amendment and the H.R. 4509, and I yield back.
Thank you, Mr. Bean. Are there any members who wish to be recognized for further discussion on the amendment and the nature of a substitute?
Thank you.
Mr. Scott, you're recognized for 5 minutes.
Thank you, Madam Chair. I move to strike the last word, and I want to thank the Chair for her work on this bill. This bill improves the hospital billing in the commercial market by prohibiting hospitals from billing consumers of private health plans unless they comply with certain requirements. We know that the hospital industry accounts for 31% of overall health spending in the U.S. and is the largest single contributor to our national health expenditures. By addressing unfair billing practices, the legislation will help hold down healthcare costs for consumers. Specifically, the bill ensures that healthcare providers will be transparent with bill plans and consumers by providing sufficient information to accurately determine the setting in which the care is provided. This is particularly important as across the country, hospitals are acquiring independent physician offices and converting them to hospital outpatient departments, HOPDs. HOPDs are able to charge a facility fee and receive a higher reimbursement than freestanding physician's office or other lower cost settings, even when the care provided may be essentially identical. And while it may be appropriate and necessary for care provided in certain settings to receive higher reimbursement based on a variety of factors, this is not true across the board. In some instances, once a hospital acquires a physician's office, as the gentleman from Florida has suggested, the only thing that changes is the sign on the door. This does not justify an increased cost to the plan or consumer. This bill will ensure that providers are transparent about the location of the services provided when they submit a bill to a health plan. This legislation, along with recent actions announced by the Biden administration to crack down on unfair facility fees, presents a meaningful opportunity to ensure that the system isn't being gamed in a way that increases costs for workers. There's been demonstrated bipartisan and bicameral interest in this issue, and I'm glad that the committee has also prioritized moving these efforts forward. Thank you again, Madam Chair, and urge my colleagues to support the amendment and the underlying bill and yield back the balance of my time.
Thank you, Mr. Scott. Are there other members who wish to be recognized? Mr. Good, you're recognized for 5 minutes.
Thank you, Madam Chairman. I move to strike the last word. As hospitals have bought up physician practices over the last 20 or so years, it's become apparent that they are using this to their advantage. Hospital care can be more expensive because of the emergency nature of it, but that's not an excuse for hospitals to jack up all of their costs. The Transparency in Billing Act prohibits dishonest billing and will prevent a hospital from charging higher prices for doctor services as if they were occurring in a hospital setting. This legislation simply requires hospitals to correctly indicate through billing codes where the service took place and what the service was. This reform, when paired with the reporting requirements that we will discuss in my legislation later today during this markup, will expose what Americans already know to be true, that there can be vast, unjustified discrepancies in healthcare costs, and we need to do what we can to combat those discrepancies. Hospitals are incentivized to eliminate competition through market consolidation because historically, billing practices have allowed hospitals to charge more for services that are conducted at their facilities. I believe that payment for a healthcare service should be the same regardless of where the service takes place. This legislation starts to challenge the narrative that location can or should determine cost. I believe the result over time will be an increasing demand from the market to bring more consistency to how we pay for care. And I thank Chairman Foxx for introducing this bill, and I'm happy to support its advancement to the full House, and I yield back.
The gentleman yields back. Are there any other members who wish to be recognized? Dr. Adams, you're recognized for 5 minutes.
Thank you, Madam Chair. Move to strike the last word. I do support the Transparency in Billing Act, which will amend the Employee Retirement Income Security Act of 1974 to require taxpayers to pay only claims submitted by hospitals that have policies and procedures in place to ensure fair billing practices. In recent years, hospitals have brought out physician practices and turned them into hospital outpatient departments. But today, over half of all physicians are employed by either hospitals or large healthcare delivery services. According to Third Way, 46.9% of physicians were employed by hospitals in 2019, and since 2019, that number has increased steadily to reach 52.1% as of last year. When hospitals buy out these physicians' practices, they are able to charge a facility fee, which is an extra charge for providing the same service. This added cost contributes to driving up out-of-pocket costs for patients. Hospitals are contributing to a larger problem in billing prices, which has resulted in a rise in prices for outpatient services. Outpatient services are projected to grow faster than any other service over the next decade at a steady growth of 87%. Growth in Medicare spending on outpatient departments outweigh growth in other areas, including prescription drugs, hospitals, home health care, and skilled nursing facilities, and that is not sustainable. Patients, hardworking Americans, our families and friends can no longer afford to shoulder these skyrocketed costs, high premiums, and crippling medical debt. These additional fees for patients receiving care at hospital outpatient departments are more than receiving the same care elsewhere. Affordable and equitable health care is something every American deserves. They need the United States to ensure that there is oversight for these aggressive practices that will prevent them from paying prices that they shouldn't have to pay. So I do thank my colleagues for this bipartisan legislation. It will be a step in the right direction because it is driving down the cost of health care for our constituents. It will truly enforce transparency in billing. We have a sacred responsibility to ensure that every American has access to quality and affordable health care. So let's continue to work together to make that happen. I do urge my colleagues to support this bipartisan bill. And with that, Madam Chair, I yield back.
Thank you, Dr. Adams. Does any other member wish to speak on the amendment in the nature of a substitute? There being no further discussion on the amendment in the nature of a substitute, the committee will move to consideration of amendments. There being no amendments, we'll move to consideration of the next bill. Yes, sir.
Could we consider the substitute? The substitute?
We're going to roll it. Is that okay?
Voice the substitute. Move around along. Yeah, go ahead.
Committee will now proceed to consideration of the bill H.R. 4507 for amendment. The bill was circulated in advance and printed copies are available. The clerk shall designate the bill.
H.R. 4507 to amend the Employee Retirement Income Security Act of 1974 to promote transparency in health coverage and reform pharmacy benefit management services with respect to group health plans and for other purposes.
Without objection, the first reading of the bill dispensed with. Without objection, the bill will be considered as read and open for amendment at any point, and any amendment offered shall be considered as read. I now recognize Mr. Good to offer an amendment in the nature of a substitute. The clerk shall designate the amendment in the nature of a substitute.
Amendment in the nature of substitute to H.R. 4507 offered by Mr. Good of Virginia, identifier plan-transparency_ANS.
Without objection, the amendment shall be considered original text for purpose of further amendment. The amendment in the nature of a substitute has already been distributed. I now recognize Mr. Good for 5 minutes to explain the amendment in the nature of a substitute.
Thank you, Madam Chairman. I'd like to offer an amendment in the nature of a substitute for my legislation, the Transparency in Coverage Act. It amends the Employment Retirement Income Security Act of 1974, or ERISA, by codifying a Trump administration rule with the same name. Transparency in coverage will give patients and plan administrators real-time access to prices for medical services and prescription drugs in advance of care. This committee remains committed to lowering health care costs for working American families. The Health, Employment, Labor, and Pensions, or HELP subcommittee, has already held multiple hearings in this 118th Congress focused on price transparency and affordability in the American healthcare system. The first pillar of this bill is transparency in medical services. Under the current system, two patients can get the same procedure in the same hospital but have completely different costs, with their insurance plans covering vastly different amounts. Americans know that this is ridiculous, and they're tired of finding out after the fact what insurance plans will actually cover. Healthcare plans should provide beneficiaries with detailed out-of-pocket cost information and negotiated rates for covered healthcare services. Beginning in January of this year, requirements from the Trump rule have been enforced, such as publicly disclosing contracted prices and creating cost-sharing tools. Still, the provisions need to be codified into law, which is what my bill does. My bill also improves the usability of the data that healthcare plans are starting to report. Unleashing third-party developers to create innovative apps and tools to share this health data will improve the patient experience. Unfortunately, the Trump rule provision regarding prescription drug pricing disclosure has been indefinitely delayed by the Biden administration, and that brings me to the second pillar of this bill, transparency in prescription drug costs. Passing H.R. 4507 will enable full implementation of prescription drug cost reporting. Additionally, it would bring much-needed light to backroom deal-making between pharmacy benefit managers, or PBMs, and pharmaceutical manufacturers on rebate pricing. PBMs do not have the best interests of patients in mind. The Transparency in Coverage Act is a critical step toward promoting transparency and affordability in healthcare. When patients can see who offers the best prices, the market can respond to the demand for lower prices. By requiring increased price transparency for providers and oversight of PBMs, we can empower patients with the information they need to make informed decisions and reduce healthcare costs. I urge my colleagues to support H.R. 4507, and I yield back.
Thank you, Mr. Good. Are there any members who wish to be recognized for further discussion on the amendment in the nature of a substitute? Mr. DeSanya, you're recognized for 5 minutes.
Thank you, Madam Chair. I move to strike the last word.
You're recognized for 5 minutes.
Thank you, and I want to thank you, Ranking Member Scott, and I want to also thank Chairman Good and your staff for working with our staff. It's a collaborative moment that will benefit the American public, and I'm very appreciative. As we've discussed in the Health Subcommittee already in this Congress, lack of transparency in healthcare limits our ability as policymakers to improve the healthcare system. I was pleased to introduce the Transparency and Coverage Act with Chairman Good. This bill codifies core provisions of the Transparency and Coverage final rules issued under the Affordable Care Act, and also makes improvements so that the information is more accessible and digestible. This bill requires group health plans and issuers to make publicly detailed information regarding in-network rates, allowed amounts of out-of-network services, volume restrictions, and medical management requirements. It also requires group health plans and issuers to establish an online self-service tool that allows the real-time provision of information directly to consumers, and the bill requires group health plans and issuers to make publicly available 3 separate machine-readable files containing in-network information, out-of-network information, and prescription drug information. All of these provisions work together to give payers and consumers alike more information about how healthcare dollars are being spent. Importantly, the bill includes a provision that requires the Department of Labor to report on incorporating information regarding the ability of care alongside cost data. As we work to lower costs, it is also important that we raise the quality of healthcare, that these issues go hand in hand. The bill also includes measures to improve transparency in pharmacy benefit management. It requires pharmacy benefit managers, or PBMs, and other entities to submit detailed reports to plan administrators on a quarterly basis containing information about a group health plan's prescription drug benefit. This includes information such as the amount of rebates, fees, and discounts PBMs receive, and total gross and net spending on prescription drugs under the plan, and information regarding copay assistance programs and other discounts funded by drug manufacturers. These disclosures will provide critical insight into practices that are unfortunately notoriously opaque and can drive up costs for consumers. Before I close, I want to note that, as I've said before, promoting transparency, and I'm really delighted about how we're hearing about this on a bipartisan basis today and in the hearings, that promoting transparency and competition alone will not solve the problem of high healthcare costs. As the issue of surprise medical billing showed us, we cannot fully address market failures without more direct action to ensure our constituents have access to affordable, high-quality care. Over the past few years, Democrats and Republicans have made bipartisan progress to address these issues. In 2020, we came together to pass the No Surprises Act and the Consolidated Appropriations Act of 2021, or the CAA. These bipartisan achievements show that we can work together, Democrats and Republicans, to lower health care costs for workers and families and increase quality of care. There's still an urgent need for further action, and today we take this first important step. Again, I want to thank my colleagues. Chairman Good, thank you so much for working with us, and Chairman Foxx and Ranking Member, thank you for all your support. This is a good day for American consumers.
Thank you, Mr. DeSagne. Are there any members who wish to be recognized for further discussion on the amendment in the nature of a substitute? Mr. Burleson, you're recognized for 5 minutes.
I move to strike the last word. Is that the right phrase?
You're recognized for 5 minutes.
Thank you. You know, I just got elected. I just got up here, but you know, I can tell you from my private sector life is that there's just frustration with what happens in D.C. There's frustration that we pass all that they pass all these laws that end up, you know, while they're well-intentioned, they ultimately end up doing nothing but continuing to raise the costs of healthcare. And there's this belief that we can force a free market if we only regulate it, if we only pass enough laws. and that if we just pass this one more law, then we can start seeing costs come down. And I've become convinced that we're only pushing ourselves towards a single payer model. You know, the assumption here is that businesses are not capable of negotiating with PBMs. And I can tell you firsthand, having been someone who's served in a capacity where we had to negotiate and take bids from insurance carriers and decide if we're going to stay with that carrier or go to a different carrier or hire a PBM or not hire a PBM. Those decisions, to suggest that the decision makers, whoever's running an HR company at an ERISA plan or the president of a company, that they don't care about the lives of their employees is hogwash. They care about the lives of their employees. They care about the product that they're getting. They care about the prescriptions and the cost of those prescriptions. And what they don't want to see happen is these costs get overrun. And so, sadly, I think that, yes, it would be great if there was transparency, but the market cannot be dictated by the government, and you end up with an outcome such as this. So I think that the downstream impacts will ultimately increase healthcare costs, and with that, I'll be opposing the bill.
Thank you very much, Mr. Burleson. Are there other members? Dr. Adams, you're recognized for 5 minutes.
Thank you, Madam Chair. I move to strike the last word. I do want to urge my colleagues to support the Transparency and Coverage Act, which will improve transparency in the pharmacy benefit manager market and ensure that group health plans and insurers provide useful cost-sharing information for consumers. The practices used by PBMs have relieved health plan sponsors of the responsibility of managing pharmaceutical benefits. However, PBMs are often criticized for their business practices, which lacks transparency. There are 3 PBMs that have a monopoly over the prescription drug market, controlling nearly 80% and operating with little to no oversight from the federal government. Rebates negotiated by PBMs are kept under lock and key, and they also receive incentives from manufacturers. The late Reverend Dr. Martin Luther King once said, of all of the forms of inequality and injustice in healthcare is the most shocking and the most inhumane because it often results in physical death. Unfortunately, that is still true, and there are major gaps in care based on socioeconomic status, race, and other factors. This reality is only exacerbated by the lack of transparency that exists in every facet of our medical system. Every person is deserving of accessible and affordable health care, but this lack of transparency lends to incredibly high prescription drug prices and deceptive billing prices that drive up hospital costs. Every American deserves the dignity of a high quality and long life with their loved ones, but this cannot be a reality for the average American if we do not make major reforms to the healthcare system now. The current system is not sustainable. Patients, hardworking Americans, and our families and friends can no longer afford to shoulder unexplained costs. So I am proud of my colleagues and the bipartisan efforts we've made to address these issues with the urgency they deserve, and I remain committed to ensuring accessible, affordable, quality health care and transparency for everyone. This bipartisan bill will ensure that pricing practices are made known to consumers and will allow them to make the best decisions for themselves. So I do urge my colleagues to support this bill. And with that, Madam Chair, I yield back.
Thank you, Dr. Adams. Are there other members who wish to be recognized for further discussion on the amendment in the nature of a substitute? Mr. Ticano, you're recognized for 5 minutes.
Madam Chair, I'm so pleased to see that this committee is working on a bipartisan basis to move forward in this space of transparency for pharmacy benefit management organizations. PBMs constitute a middleman, and as my colleague Ms. Adams said, that there is a monopoly of 3 of these major PBMs. Having had personal experience in trying to ascertain what the actual price of a drug is, and how it counts against one's deductible is a major frustration. Is not only is a frustration for me, but it's also a frustration, I think, for many, many Americans on a bipartisan basis. Many members of this committee even have had struggles with this. This is a first step. I think we need to understand just what the prices are. It's really hard to ascertain what the price of any particular medication is. And so I really appreciate that the committee is moving forward in a modest way on these very necessary steps that we need to take. I yield back.
Thank you, Mr. Takano. Any other member wish to speak? There being no further discussion on the amendment and the nature of a substitute, the committee will move to consideration of amendments. For what purpose does the gentlewoman, Ms. Chavez de Reimers, seek to be recognized?
Madam Chair, I have an amendment at the desk.
The clerk will report the amendment.
Amendment to the amendment in the nature of a substitute to H.R. 4507, offered by Mrs. Chavez de Reimer of Oregon, identifier DEREME_011.
The gentlewoman is recognized for 5 minutes in support of the amendment.
Thank you, Madam Chair. As a small business owner in the healthcare industry, a significant purpose of being in Congress is finding ways to help Oregonians receive the right care at the right time. Currently, step therapy protocols, sometimes referred to as fail first, cause serious delays in care and require patients to try ineffective and potentially dangerous medications before their insurance lets them use the care their doctor prescribed in the first place. I've seen patients on the verge of suicide because of the pain they're in, pain directly caused by step therapy protocols blocking access to the prescribed care. That's why I'm offering the bipartisan Safe Step Act as an amendment today, a bill I am proudly co-leading with the gentlewoman across the dais, Congresswoman McBath. The Safe Step Act would prevent excessive delays and extra expenses to ensure patients can quickly access safe and affordable care. This much-needed piece of legislation would provide guardrails by requiring insurance companies have a clear and rapid process to allow coverage for a patient's prescribed treatment, abandoning the current system of patients languishing in pain. Madam Chair, I understand that this amendment isn't germane to the legislation in today's markup, but it's my hope that this Congress, alongside Congresswoman McBath and Congressman Wenstrup, we can work together on advancing this issue.
The gentleman yields back. For what purpose does the gentlewoman from Georgia, Ms. McBath, seek recognition?
Madam Chair, I move to strike the last word.
The gentlewoman's recognized for 5 minutes.
Thank you, Chairwoman Foxx, Ranking Member Scott, and to your staff for making today's bipartisan health care markup possible. As I have shared to this committee before, I have personally survived 2 different bouts of breast cancer, and I am also the daughter of 2 healthcare providers. I've seen this industry as a patient, but also from a provider's perspective, and I know that there's so much that we can do together to ensure that every American has access to the care that they need, when they need it, and at a price that they can afford and that their families can afford. Healthcare is very personal to me, and it's so important that we get this right for the folks that are counting on us back in our home districts. And I thank the chair for hosting today's markup to bring more transparency to the healthcare space and lower prices for everyday Americans. A similar topic that is also important to patients and providers is streamlining insurance-mandated step therapy. Under current law, patients in certain situations are required to try and fail other medications before being able to take advantage of the treatment that has been recommended by their doctor. And I'm just going to take a point of privilege to say that my husband's going through that right now. He is undergoing treatment, and we're trying to figure out what medications really work for him, the medications that he's on right now are actually failing him. And so while we're going through this process, we are right now doing the very thing that we're talking about at this moment. This one-size-fits-all approach causes unnecessary delays in care and also exposes patients to expensive and possibly dangerous medications that their doctors have not recommended for their treatment. Our bill, the Safe Step Act, would actually streamline this system by requiring insurance companies to have a clear and rapid process to allow coverage for the medication or treatment that is best for the patient as prescribed by their doctors without having to try other medications beforehand. This bill will have a tangible and positive impact on patients while also taking steps to reduce wasteful spending on drugs that doctors say will not solve the medical issues that they are intended to solve. I appreciate all the hard work and feedback from the chairwoman and her team on the Safe Step Act. And I look forward to working with you, Representative Chavez-DeRemer, both of us working as hard as we can to get this important bill signed into law, and I yield back.
Thank you, Ms. McBath. Mr. Burleson, you're recognized for 5 minutes.
I feel like I'm going to repeat myself a little bit here, but there, in the healthcare, I'm sorry, strike the last word. Thank
5
you.
minutes.
Within healthcare, we have completely removed any cost transparency or decision making from any patients, okay? The more that we continue to remove any negotiating ability, the more that the costs are going to go up. This amendment will completely neuter the negotiation ability of pharmacy benefit managers and insurance companies to negotiate down the pricing. Why will it do that? Because you're eliminating their ability to group into and select which pharmaceuticals are more cost effective for the outcomes of that patient. Now, to suggest that they don't care about outcomes is ridiculous. If you have normative data and you're covering the lives of millions, if not hundreds of millions of patients, you know statistically what is the best prescription what has the best outcome for a patient statistically. And yes, while that sometimes a doctor may disagree with that prescription, at the end of the day, the doctor is practicing medicine, okay? And having more eyes on that decision is helpful. The current law allows for a patient to circumvent whatever prescription that they've been placed on step, given, after they fail or given a doctor's ability to break the glass, if you will. But if you eliminate the ability to group and create formularies and be able to determine what prescriptions are preferred, then you're eliminating their ability to negotiate with pharmaceutical companies altogether. And I think that this will be a dangerous step to allowing pharmaceuticals to skyrocket.
Thank you, Mr. Burleson. Are there other members who wish to speak on the amendment? Well, I want to thank Ms. Chavez-DeRemer for raising this important issue. I've also heard concerns from constituents unable to access needed and prescribed medications because of step therapy protocols. I appreciate the work that her office has put into improving this legislation, including working with the Centers for Medicare and Medicaid Services, employers, and other stakeholders to address their feedback. I look forward to continuing to work with Ms. Chavez-DeRemer on this legislation to ensure that the Safe Step Act strikes the right balance between securing patient access to life-saving medication and ensuring employer-sponsored insurance premiums don't rise. And I appreciate the fact that we have members on the committee who are dealing with this issue right now and can bring information to inform us. Ms. Chavez DeRemer, you're recognized.
Thank you, Madam Chair. I appreciate the continuation that you will have us work. Congresswoman McBath, I look forward to working with you. And with that commitment, then, Madam Chair, with that, I will withdraw my amendment.
Thank you very much. Are there other members who wish to offer an amendment? There being no amendments, we'll move to consideration of the next bill. The committee will now proceed to the consideration of the bill H.R. 4527 for amendment. The bill was circulated in advance and printed copies are available. The clerk will designate the bill.
H.R. 4527 to amend the Employee Retirement Income Security Act of 1974 to ensure plan fiduciaries may access de-identified information relating to health claims and for other purposes.
Without objection, the first reading of the bill is dispensed with. Without objection, the bill will be considered as read and open for amendment at any point, and any amendment offered shall be considered as read. I now recognize Ms. Chavez DeRemer to offer an amendment in the nature of a substitute. The clerk shall designate the amendment in the nature of a substitute.
Amendment in the nature of a substitute to H.R. 4527 offered by Mrs. Chavez DeRemer of Oregon, identifier data_ACC_ANS.
Without objection, the amendment shall be considered original text for purposes of further amendment. The amendment in the nature of a substitute has already been distributed. I now recognize Ms. Chavez DeRemer for 5 minutes to explain the amendment in the nature of a substitute.
Thank you, Madam Chair. I would like to offer an amendment in the nature of the substitute for the Health Data Act, or H.R. 4527, which amends the Employee Retirement Income Security Act of 1974, ERISA, to ensure employers are not contractually restricted from obtaining costs or quality of care information about their own health care plans. Since the enactment of the bipartisan No Surprises Act in 2020, the executive branch has attempted to provide regulatory guidance for the law's implementation. The issue at hand today is that Section 724, the gag clause prohibition, needs to be strengthened. The gag clause prohibition is meant to ensure employers aren't prevented by PBMs or third-party administrators from receiving important healthcare data they're entitled to see. This data allows employers to see why costs are what they are. And this access will ensure that employers are able to meet their duty to provide workers with the best plan. Employers shouldn't be barred by armies of corporate lawyers from knowing the cost of information of their own plans. The Health Data Act is an effort to close the loopholes in current law and increase transparency in the system. Service providers are circumventing current law by limiting the number of claims an employer can audit, limiting the number of audits an employer can conduct, demanding the audit be conducted by their own company, and hiding indirect compensation received by the service provider for its role administering a plan, and demanding that the audit take place on the service provider's premises. Also, the incentives of Section 724 are misaligned. As written, it restricts the health plan issuer from agreeing to a gag clause instead of the intended service providers and third-party administrators. Finally, although the Centers for Medicare and Medicaid Services have created a website for gag clause attestation, it has wrongly allowed service providers to attest on behalf of health plan issuers. Talk about a conflict of interest. This bill fixes an underlying bipartisan agreement, and I believe that the spirit of that agreement still stands. For those reasons, I look forward to voting for the Health Data Act. I also want to thank the Education Workforce Committee staff who have worked so hard on this bill and the incredible overall package we're voting on today, especially Taylor, Seth, CJ, Mindy, and John. With that, I yield back, and thank you.
Thank you. I will echo what you said about the staff working very, very hard on these pieces of legislation. Are there any members who wish to be recognized for further discussion? Mr. DeCano, you're recognized to
Thank
for
you,
5
Madam.
minutes on the amendment in the nature of a substitute.
Thank you, Madam Chair. I move to strike the last word.
You're recognized for 5 minutes.
I thank the gentlewoman from Oregon for working on this bill. The bill builds upon the gag clause prohibition passed into law in the Consolidated Appropriations Act of 2021, the CAA. Before the CAA, so-called gag clauses restricted insurers from making critical price and quality information available to other parties, including employers. Despite the improvements made by the CAA, some have attempted to circumvent the new law and make necessary information intentionally opaque. There are reports that some service providers, such as PBMs, incorrectly believe they are not subject to these transparency requirements. In addition, third-party administrators, TPAs, continue to erect barriers that limit access to data. For example, by limiting the number and frequency of audits and imposing burdensome fees for accessing plan data. These hurdles block employers from ensuring they are fulfilling their fiduciary obligations, including recovering overpayments, and are prohibited under the CAA. So access to this data is crucial to ensuring employers are administering the plan in the best interests of their members. Circumvention by insurers and third parties makes it difficult for employers to keep employee health insurance costs in check. This bill would ensure that the CAA is implemented consistent with congressional intent, including ensuring that group health plan fiduciaries may audit plan data to ensure compliance with the terms of the plan and applicable law and the reasonableness of the compensation paid. Ensuring that entities that are responsible for violations of gag clause prohibition are held liable, and clarifies that PBMs may be penalized for violations. Strengthening the attestation requirement for compliance with the gag clause prohibition, and requiring the Secretary of Labor to issue a report on whether plan data could be considered a plan asset under ERISA. Now, this plan has the potential, this bill has the potential to improve quality while simultaneously lowering costs, providing the Department of Labor authority to impose a civil and monetary penalty, a CMP, against entities that put an illegal gag clause in their contract, gives teeth to anti-competitive laws intended to keep these entities honest. The bill importantly adds PBMs explicitly to the list of service providers who can be liable for violating the gag clause. I urge my colleagues to support the bill, and I yield back the balance of my time.
The gentleman yields back. Are there other members who wish to speak? Ms. Manning, you're recognized for 5 minutes.
Thank you, Madam Chair. I move to strike the last word.
You're recognized for 5 minutes.
Thank you. Transparency in our healthcare system is absolutely critical to lowering costs. In a recent hearing, we heard about the opaque practices of pharmacy benefit managers and how they manage to raise costs both for employers that purchase plans and for beneficiaries that need prescription drugs. PBMs are able to obscure the profits they take as middlemen, leaving employers in the dark and small pharmacies in the dust. The same goes for third-party administrators and brokers that act as middlemen for health data. They can structure their contracts with health plans to prevent information about quality of care and costs from being shared with a plan fiduciary. In other words, someone with a responsibility to run health plans in the interest of the patients. Our healthcare system is a market-based system. Without transparency, that market can't work as it should. PBMs and other middlemen don't have to ensure that plans cover the highest quality, lowest cost care available. At the end of the day, patients pay the price for these policies. Like many Americans and like many of my colleagues in this room, I had to fight for my daughter to access affordable care. So for many working families, they continue to face that struggle every single day. That's why I'm so proud to be introducing the Health Data Act alongside my colleagues on this committee, Ms. Chavez de Remer and Mr. Takano. The Health Data Act would make unfair contracts between TPAs and health plans. Service providers would be prohibited from blocking a fiduciary's access to plan information or put it behind a paywall. Fiduciaries will be able to audit insurance claims data. I thank both Ranking Member Scott and Chairman Foxx for putting together this important markup of bipartisan healthcare legislation. I urge my colleagues to vote to pass the Health Data Act to improve quality of care and transparency of costs for all Americans. Thank you, and I yield back.
Thank you, Ms. Manning. Are there other members who wish to be recognized for further discussion on the amendment in the nature of a substitute? There being no further discussion on the amendment in the nature of a substitute, the committee will move to consideration of amendments. There being no amendments, we will move to consideration of the next bill. H.R. 4508, the Hidden Fee Disclosure Act. The committee will now proceed to consideration of the bill, H.R. 4508, for amendment. The bill was circulated in advance and printed copies are available. The clerk shall designate the bill.
H.R. 4508 to amend the Employee Retirement Income Security Act of 1974 to clarify and strengthen the application of certain employer-sponsored health plan disclosure requirements.
Without objection, the first reading of the bill is dispensed with. Without objection, the bill will be considered as read and open for amendment at any point, and any amendment offered shall be considered as read. I now recognize Mr. Courtney to offer an amendment in the nature of a substitute. The clerk shall designate the amendment in the nature of a substitute.
Amendment in the nature of a substitute to H.R. 4508 offered by Mr. Courtney of Connecticut, identifier PBM_ANS.
Without objection, the amendment shall be considered original text for purposes of further amendment. The amendment in the nature of a substitute has already been distributed. I now recognize Mr. Courtney for 5 minutes to explain the amendment in the nature of a substitute.
Thank you, Madam Chairwoman. And first of all, I want to thank you, Ranking Member Scott, Chairman Good, Ranking Member DeSaulnier, and Congresswoman Erin Huchin from Indiana for all your hard work in terms of today's bipartisan markup. It is heartwarming to see our committee lead the way addressing what is one of the most important issues to Americans, the cost of health care. About a half of Americans have employer-sponsored health insurance, and our committee, by virtue of its jurisdiction over the Employment Retirement Income Security Act, has a critical role to play in ensuring that coverage is affordable, transparent, and high quality. The Hidden Fee Disclosure Act, which I introduced this week with Congresswoman Huchin, is a common-sense bill to build on Congress's efforts to make our healthcare system more transparent. As Supreme Court Justice Louis Brandeis famously said, when it comes to public policy, sunlight is the best disinfectant. Transparency by itself can be a powerful force to achieve the goal of lowering the cost of prescription drugs for patients. This financial ecosystem is unbelievably complicated, and Congress has a duty to proceed with as many strategies as possible to address the areas of wasteful spending in healthcare by empowering fiduciaries who administer their health plans for their employees. First of all, let's begin with the basics. Prescription drug prices are now the biggest cost drivers of employer-sponsored health plans. The portion of healthcare premiums attributable to paying for prescription drugs is now 22 cents of every dollar, the largest single share compared to any other category, more than inpatient hospital stays, more than doctor's appointments, more than emergency room visits, and more than outpatient hospital services. Employers and their employees who pay the bill, and I was a small employer for 25 years before coming to Congress, deserve to know that the insurance products that they are buying were negotiated in their best interests. This bill builds on the progress made with the Consolidated Appropriations Act of 2021 and is done in tandem, by the way, with all the other bills because we're amending a separate section of ERISA in this measure. Extends the existing ERISA disclosure requirements to new groups of vendors that do business with group health plans. With this bill, we are clarifying that existing rules apply to contractors like pharmacy benefit managers and spelling out the information about their business practices that they need to disclose to the employers who are their clients that pay for their services. This change will improve transparency in some of the most opaque and costly elements of our healthcare insurance system. There are many examples of practices used to set prescription drug benefits that can lead to higher costs for patients and which justify passage of this measure. For example, A PBM could put a more expensive drug on a formulary because it leads to higher reimbursement for them, even if there is a lower cost generic alternative available, and even if it means that the employer and the patient pay more. Or a PBM could negotiate a rebate for sales of certain drugs, offsetting some costs to the plan, but leaving the patients to pay cost sharing on the full list price of the drug. By sharing information about the types of compensation that PBMs receive, the type of rebates, price concessions, or discounts they negotiate, plan fiduciaries, which are employers and employees, can ensure that they are paying for services that lower costs for themselves and their families, and that dollars aren't diverted to products or companies that don't provide value to the people who are covered in their plans. When combined with other bills that we're marking up today, this will be a powerful tool that will allow plan fiduciaries to ensure that the fees they pay are reasonable and that their vendors are free of any conflicts of interest that drive up costs. This transparency, as Justice Brandeis once said, is a good thing for both employers and for workers. Thank you again to Chair Foxx, Ranking Member Scott, and I urge a yes vote on this bill.
Thank you, Mr. Courtney. Are there any members who wish to be recognized for further discussion? Ms. Houchin, you're recognized for 5 minutes.
Thank you, Madam Chair. I want to speak in favor of the amendment in the nature of a substitute for H.R. 4508. I thank Congressman Courtney for working together on this piece of legislation, which ensures pharmacy benefit managers are complying with disclosure requirements written into the No Surprises Act. The enactment of the No Surprises Act in 2020 was an important achievement for this legislative body and a win for hardworking families across America. The law was conceived to protect patients from surprise medical billing, because no American should live in fear of his or her medical bills, but also to foster transparency and competition more generally in the healthcare system. While many provisions of the law have worked as intended, the compensation disclosure requirements for consultants providing services for health plans may have been construed too narrowly by PBMs. The Employee Benefits Security Administration has even issued guidance insisting on a board interpretation and application of the law, but to no avail. Now the law's scope must be clarified. PBMs are the middlemen between health plans and drug manufacturers, a role in which they ostensibly provide a consultant service. This seemingly minor detail is very important to the lives of everyday Americans. I routinely hear from constituents concerned over rising prescription drug prices. Some have come to me and told stories about they used to be able to get a 3-month supply of medication, and now they're getting a 1-month supply of medication, and it's more costly than the 3-month supply. The American people deserve answers as to why this is occurring, and this is an effort to ascertain the much-deserved answers that the American people deserve. What is the actual savings? Who is benefiting from the negotiations? Would another formulation be more cost-effective? We have a duty to clarify the No Surprises Act and ensure transparency through the law by passing H.R. 4508. Therefore, I urge the passage of H.R. 4508. I thank the chairwoman for hearing the legislation, and I yield back.
Thank you, Ms. Houchin. Mr. Scott, you're recognized for 5 minutes.
Thank you, Madam Chair. I thank the gentleman from Connecticut and the gentlewoman from Indiana for their leadership on this bill. The committee worked on a bipartisan basis to enact the No Surprises Act as part of the Omnibus Appropriations Act in 2020. We included a provision that amended ERISA to apply fee disclosure requirements to group health plans. Under this provision, no contract arrangement between a group health plan and a covered service provider is permitted unless the covered service provider discloses direct and indirect compensation received in connection with the services they provide for the plan. Covered service providers subject to the provision include brokers who frequently receive payments that create conflicts of interest, as well as entities that may provide consulting services to the plan, specifically pharmacy benefit management, third-party administration, and several other services enumerated in the statute. There have been reports that many large service providers are not in compliance with this requirement. From 2022, I joined then Ranking Member Foxx in sending a bipartisan letter urging the Department of Labor to issue guidance clarifying that these disclosure requirements apply to all entities listed in the statute. This bill clarifies the application of these requirements to covered service providers and further strengthens required disclosures for pharmacy benefit managers and third-party administrators. This eliminates any ambiguity and will give health plan fiduciaries information they need to ensure that the fees they pay are reasonable and that the service providers do not have any hidden conflicts of interest. Improving disclosure is a key to building transparency in our healthcare system, shining a light on compensation practices that could be driving up costs for consumers. So I urge my colleagues to support the amendment in nature of a substitute and the underlying bill, and yield back the balance of my time.
Thank you, Mr. Scott. Mr. Burleson, you're recognized for 5 minutes.
Thank you, Madam Chair. I move to strike the last word.
You're recognized for 5 minutes.
You know, I agree with the remarks that pharmaceutical costs are going up and that they are a driving force, and agree that 22% of every dollar is now in healthcare going to pharmaceuticals. But unfortunately, the goal of this language, if it's to reduce or lower healthcare or prescription drug costs, I think the bill gravely misses the mark here. And again, I'll reiterate, having known firsthand, sitting on a board that covers the lives of over 100,000 employees and retirees, it gives you the ability to negotiate with insurance carriers and PBMs. And sometimes if a PBM is costing too much or they're not providing good care, adequate care, or transparent care or information to the employer or to the employees, then you get to pick. Thank God we have a free market. In fact, a Bank of America study showed recently that 36% of employers have done just that. If they, by using costs, they've picked a different PBM. But what we're doing here today is essentially we're complaining about the price of steaks at a restaurant, and in order to fix it, we're going to go after the food broker and impose regulations on the food broker. This will not help reduce the costs of healthcare. I'd like to enter into the record, Madam Chair, a report from the OIG that was released earlier this year.
Without objection.
Thank you. What this report says is that between the years of 2015 and 2020, the Department of Labor Office Workers' Compensation Program wasted over $321 million in taxpayer money. And how did they do that? Because they failed to use a PBM to control or contain the costs of their pharmaceuticals. Even worse, the report said that they did not effectively monitor their own pharmaceutical policy changes, resulting in inappropriate prescriptions and potentially lethal drugs, including 1,300 prescriptions for fast-acting fentanyl. While we hear about that transparency is the answer, there's nothing more transparent than the employer or the buyer knowing the full cost of the plan. And so, again, I will be opposing this amendment. I think that the more that we do to eliminate the ability of the negotiating arm within healthcare on pharmaceuticals, it will only benefit big pharma. It will only benefit pharmaceutical companies who wish to make even more profits than they do today. And I yield back.
Thank you, Mr. Burleson. Are there other members who wish to be recognized for further discussion on the amendment in the nature of a substitute? There being no further discussion on the amendment in the nature of a substitute, the committee will move to consideration of amendments. There being no amendments, the committee will stand adjourned. The committee will commence votes on... Oh. The committee will recess, says adjourned, sorry, will recess. The committee will commence votes on these 4 bills immediately following the first floor vote series. So come back around 2 o'clock, hopefully, and we will vote. Thank you very much. The committee will please come to order. A quorum is present. I now recognize the ranking member for a brief comment.
Thank you, Madam Chair. Before we begin voting, I just wanted to address a matter in H.R. 4507, the Transparency and Coverage Act, which is the second bill that we'll be voting on. I want to thank again Chairman Good and Ranking Member DeSaulnier for their work on this bill, as well as your work and the bipartisan work of the committee. It is my understanding that our staffs will continue to work on a bipartisan basis on this bill as it continues to move forward. There's been some concern raised about a provision included in the bill which allows for the submission of certain information in lieu of a dollar amount in limited circumstances. The intent of this language was not to create new loopholes or allow evasion of the law, and some have expressed concern. So it remains my priority to ensure this bill maintains and improves compliance with transparency requirements. Therefore, minor changes may be needed as we move forward to ensure that our intent is precisely captured in the legislative language. So I want to thank you, Madam Chair, for your commitment to work together to fix this issue as the bill moves forward, and I yield back the balance of my time.
Thank you. Pardon me. Thank you very much, Mr. Scott. I certainly agree to work with you and others to address the concerns that you've raised. And I'm actually very pleased with the progress we are making on these 4 bills today. With that, the question now occurs on the amendment in the nature of a substitute to H.R. 4509. All in favor say aye. Aye. All opposed, no. In the opinion of the chair, the ayes have it, and the amendment in the nature of a substitute is agreed to. I now entertain a motion to report the bill and recognize Mr. Bean.
Thank you very much, Madam Chair, and good afternoon, Education and Workforce. I move the Committee on Education and Workforce report the bill, H.R. 4509, to the House of Representatives with amendment in the nature of a substitute and with the recommendation that the amendment be agreed to and the bill as amended do pass.
The question now occurs on reporting H.R. 4509 as amended to the House with a favorable recommendation. All in favor say aye. Aye. All opposed, no. In the opinion of the chair, the ayes have it, and the motion is agreed to. Mr. Scott requests a recorded vote. A recorded vote has been requested. The clerk will report the tally.
Ms. Foxx.
Sorry. The clerk will call the roll.
Ms. Foxx.
Aye.
Ms. Foxx votes aye. Mr. Wilson. Mr. Thompson. Mr. Thompson votes aye. Mr. Wahlberg. Mr. Wahlberg votes aye. Mr. Grothman. Mr. Grothman votes aye. Ms. Stefanik. Ms. Stefanik votes aye. Mr. Allen. Mr. Allen votes aye. Mr. Banks. Mr. Banks votes yes. Mr. Comer. Mr. Smucker. Mr. Smucker votes aye. Mr. Owens. Mr. Owens votes aye. Mr. Good. Mr. Good votes aye. Ms. McLean. Ms. McLean votes aye. Ms. Miller. Ms. Miller votes aye. Ms. Steele. Ms. Steele votes aye. Mr. Estes. Mr. Estes votes aye. Ms. Letlow. Ms. Letlow votes aye. Mr. Kiley. Mr. Bean. Mr. Bean votes aye. Mr. Burleson. Mr. Burleson votes aye. Mr. Moran. Mr. Moran votes aye. Mr. James. Mr. James votes aye. Ms. Chavez-Dreamer. Ms. Chavez-Dreamer votes aye. Mr. Williams. Ms. Houchin. Ms. Houchin votes aye. Mr. Scott. Mr. Scott votes aye. Mr. Grijalva. Mr. Courtney. Mr. Courtney votes aye. Mr. Sablon. Mr. Sablon votes aye. Ms. Wilson. Ms. Bonamici. Ms. Bonamici votes aye. Mr. Tucano.
Aye.
Mr. Tucano votes aye. Ms. Adams.
Aye.
Ms. Adams votes aye. Mr. DeSaulnier. Mr. DeSaulnier votes aye. Mr. Norcross.
Aye.
Mr. Norcross votes aye. Ms. Jayapal. Ms. Wild. Ms. Wild votes aye. Ms. McBath. Ms. Hayes. Ms. Hayes votes aye. Ms. Omar. Ms. Stevens. Ms. Stevens votes aye. Ms. Ledger-Fernandez. Ms. Ledger-Fernandez votes aye. Ms. Manning.
Aye.
Ms. Manning votes aye. Mr. Mervan. Mr. Mervan votes aye. Mr. Bowman. Mr. Bowman votes aye.
Is there any member who has not been recorded? Well, I want to compliment everybody for coming back so promptly. The clerk will report. How is Mr. Kiley reported?
Mr. Kiley is not reported. Mr. Kiley votes aye.
The clerk will report the tally.
Madam Chair, how's Ms. Macbeth recorded?
Let me let them to finish and then I'll do it.
And Wilson.
Yeah. How are Ms. Wilson and Ms. McBath recorded?
Ms. Wilson is not recorded.
Ms. Wilson votes yes.
Wilson votes yes.
Ms. McBath?
Ms. McBath is not recorded. Ms. McBath votes aye. We have 1, 2, 3, 4, 5, 6. So should we? Yeah. Okay.
The clerk will report the tally.
There are 39 yeas and no nays.
The ayes have it and the motion's agreed to. H.R. 4509 is ordered reported to the House of Representatives. The chair notes for the record that a quorum is present. I ask unanimous consent that staff be authorized to make necessary technical and conforming changes to the bill as amended without objection. So ordered. Pursuant to House Rule 11, Clause 2L, I give notice that all members have the requisite number of days to file supplemental, minority, additional, or dissenting views. Without objection, so ordered. The question now occurs on the amendment in the nature of a substitute. All in favor say aye. Aye. All opposed, no. In the opinion of the chair, the ayes have it, and the amendment in the nature of a substitute is agreed to. I now entertain a motion to report the bill 4507 and recognize Mr. Good.
Thank you, Madam Chairman. I move the Committee on Education and the Workforce report the bill, H.R. 4507, to the House of Representatives with an amendment in the nature of a substitute and with the recommendation that the amendment be agreed to and the bill as amended do pass.
The question now occurs on reporting H.R. 4507 as amended to the House with a favorable recommendation. All in favor say aye. Aye. All opposed, no. In the opinion of the chair, the ayes have it and the motion is agreed to. Mr. Scott requests a recorded vote. The clerk will call the roll.
Ms. Foxx.
Aye.
Ms. Foxx votes aye. Mr. Wilson. Mr. Thompson. Mr. Thompson votes aye. Mr. Wahlberg. Mr. Wahlberg votes aye. Mr. Grothman. Mr. Grothman votes aye. Ms. Stefanik. Ms. Stefanik votes aye. Mr. Allen. Mr. Allen votes aye. Mr. Banks. Mr. Banks votes yes. Mr. Comer. Mr. Smucker. Mr. Smucker votes aye. Mr. Owens. Mr. Owens votes aye. Mr. Good. Mr. Good votes aye. Ms. McLean. Ms. McLean votes aye. Ms. Miller. Ms. Miller votes aye. Ms. Steele. Ms. Steele votes aye. Mr. Estes. Mr. Estes votes aye. Ms. Letlow. Ms. Letlow votes aye. Mr. Kiley. Mr. Kiley votes aye. Mr. Bean. Mr. Bean votes aye. Mr. Burleson. Mr. Burleson votes no. Mr. Moran. Mr. Moran votes aye. Mr. James. Mr. James votes aye. Ms. Chavez-Dreamer. Ms. Chavez-Dreamer votes aye. Mr. Williams. Ms. Houchin. Ms. Houchin votes aye. Mr. Scott. Mr. Scott votes aye. Mr. Grijalva. Mr. Courtney. Mr. Courtney votes aye. Mr. Sablon. Mr. Sablon votes yes. Ms. Wilson. Ms. Wilson votes aye. Ms. Bonamici. Ms. Bonamici votes aye. Mr. Takano.
Aye.
Mr. Takano votes aye. Ms. Adams.
Aye.
Ms. Adams votes aye. Mr. Desaulnier. Mr. Desaulnier votes aye. Mr. Norcross. Mr. Norcross votes aye. Ms. Jayapal. Ms. Wild. Ms. Wild votes aye. Ms. McBath. Ms. McBath votes aye. Ms. Hayes. Ms. Hayes votes aye. Ms. Omar. Ms. Stevens. Ms. Stevens votes aye. Ms. Ledger Fernandez. Ms. Ledger Fernandez votes aye. Ms. Manning.
Aye.
Ms. Manning votes aye. Mr. Mervan. Mr. Mervan votes aye. Mr. Bowman. Mr. Bowman votes aye.
The clerk will report the tally.
Madam Chair, on this vote, there are 38 yeas and 1 nay.
The ayes have it, the motion is agreed to. H.R. 4507 is ordered reported to the House of Representatives. Chair notes for the record that a quorum is present. I ask unanimous consent that staff be authorized to make necessary technical and conforming changes to the bill as amended. Without objection, so ordered. Pursuant to House Rule 11, Clause 2L, I give notice all members have the requisite number of days to file supplemental, minority, additional, or dissenting views. Without objection, so ordered. The question now occurs on the amendment in the nature of a substitute to the ANS to H.R. 4527. All in favor say aye.
Aye.
Aye. All opposed, no. In the opinion of the chair, the ayes have it, and the amendment in the nature of a substitute to H.R. 4527 is agreed to. I now entertain a motion to report H.R. 4527 and recognize Ms. Chavez DeReamer.
Thank you, Madam Chair. I move the Committee on Education and Workforce report the bill H.R. 4527 to the House of Representatives with an amendment in the nature of the substitute and with the recommendation that the amendment be agreed to and the bill as amended do pass.
The question now occurs on reporting H.R. 4527 as amended to the House with a favorable recommendation. All in favor say aye. Aye. All opposed, no. In the opinion of the chair, the ayes have it, and the motion is agreed to. Mr. Scott has requested a recorded vote. The clerk will call the roll.
Ms. Foxx.
Aye.
Ms. Foxx votes aye. Mr. Wilson. Mr. Thompson. Mr. Thompson votes aye. Mr. Wahlberg. Mr. Wahlberg votes aye. Mr. Grothman. Mr. Grothman votes aye. Ms. Stefanik. Ms. Stefanik votes aye. Mr. Allen. Mr. Allen votes aye. Mr. Banks. Mr. Banks votes yes. Mr. Comer. Mr. Smucker. Mr. Smucker votes aye. Mr. Owens. Mr. Owens votes aye. Mr. Good. Mr. Good votes aye. Ms. McLean. Ms. McLean votes aye. Ms. Miller. Ms. Miller votes aye. Ms. Steele. Ms. Steele votes aye. Mr. Estes. Mr. Estes votes aye. Ms. Letlow. Ms. Letlow votes aye. Mr. Kiley. Mr. Kiley votes aye. Mr. Bean. Mr. Bean votes aye. Mr. Burleson. Mr. Burleson votes no. Mr. Moran. Mr. Moran votes aye. Mr. James. Mr. James votes aye. Ms. Chavez Dreamer. Ms. Chavez Dreamer votes aye. Mr. Williams. Ms. Houchin. Ms. Houchin votes aye. Mr. Scott. Mr. Scott votes aye. Mr. Grijalva. Mr. Courtney. Mr. Courtney votes aye. Mr. Sablon. Mr. Sablon votes aye. Ms. Wilson. Ms. Wilson votes aye. Ms. Bonamici. Ms. Bonamici votes aye. Mr. Takano.
Aye.
Mr. Takano votes aye. Ms. Adams.
Aye.
Ms. Adams votes aye. Mr. Desaulnier. Mr. Desaulnier votes aye. Mr. Norcross. Ms. Jayapal. Ms. Wild. Ms. Wild votes aye. Ms. McBath. Ms. McBath votes aye. Ms. Hayes. Ms. Hayes votes aye. Ms. Omar. Ms. Omar votes aye. Ms. Stevens. Ms. Stevens votes aye. Ms. Ledger Fernandez. Ms. Ledger Fernandez votes aye. Ms. Manning.
Aye.
Ms. Manning votes aye. Mr. Mervan. Mr. Mervan votes aye. Mr. Bowman. Mr. Bowman votes aye.
Clerk will report the tally.
Madam Chair, in this vote, there are 38 yeas and 1 nay.
The ayes have it, and the motion is agreed to. H.R. 4527 is ordered reported to the House of Representatives. The chair notes for the record that a quorum is present. I ask unanimous consent that staff be authorized to make necessary technical and conforming changes to the bill as amended without objection, so ordered. Pursuant to House Rule 11, Clause 2L, I give notice that all members have the requisite number of days to file supplemental, minority, additional, or dissenting views. Without objection, so ordered. Before I call for a vote on the last bill, I want to note that today is Kate Dillon's last day with us, and to give her a hand for the great job she's done as clerk. We're really sorry to recognize her, but great talent is recognized by other people, so she is going on to really, really bigger things. I won't say better, but bigger things. And so we're sorry to lose her. And I just want to say I thank everybody for rushing back over here after votes to get this over. We all have other committees to be at, and I'm going to get through this last one as quickly as we can so other folks can get on to the other things they have to do. The question now occurs on the amendment in the nature of substitute to H.R. 4508. All in favor say aye. Aye. All opposed, no. In the opinion of the chair, the ayes have it, and the amendment in the nature of a substitute is agreed to. I now entertain a motion to report the bill and recognize Mr. Courtney.
Thank you, Madam Chair. Madam Chair, I move the Committee on Education and Workforce report the bill H.R. 4508 to the House of Representatives with an amendment in the nature of a substitute and with the recommendation that the amendment be agreed to and that the bill is amended to pass.
The question now occurs on reporting H.R. 4508 as amendment to the House with a favorable recommendation. All in favor say aye. Aye. All opposed, no. In the opinion of the chair, the ayes have it, and the motion is agreed to. Mr. Scott requests a recorded vote. The clerk will call the roll.
Ms. Foxx.
Aye.
Ms. Foxx votes aye. Mr. Wilson. Mr. Thompson. Mr. Thompson votes aye. Mr. Wahlberg. Mr. Wahlberg votes aye. Mr. Grothman. Mr. Grothman votes aye. Ms. Stefanik. Ms. Stefanik votes aye. Mr. Allen. Mr. Allen votes aye. Mr. Banks. Mr. Banks votes yes. Mr. Comer. Mr. Smucker. Mr. Smucker votes aye. Mr. Owens. Mr. Owens votes aye. Mr. Good. Mr. Good votes aye. Ms. McLean. Ms. McLean votes aye. Ms. Miller. Ms. Miller votes aye. Ms. Steele. Ms. Steele votes aye. Mr. Estes. Mr. Estes votes aye. Ms. Letlow. Ms. Letlow votes aye. Mr. Kiley. Mr. Kiley votes aye. Mr. Bean. Mr. Bean votes aye. Mr. Burleson. Mr. Burleson votes no. Mr. Moran. Mr. Moran votes aye. Mr. James. Mr. James votes aye. Ms. Chavez-Dreamer. Ms. Chavez-Dreamer votes aye. Mr. Williams. Ms. Houchin. Ms. Houchin votes aye. Mr. Scott. Mr. Scott votes aye. Mr. Grijalva. Mr. Courtney. Mr. Courtney votes aye. Mr. Sablon. Mr. Sablon votes aye. Ms. Wilson. Ms. Wilson votes aye. Ms. Bonamici. Ms. Bonamici votes aye. Mr. Takano. Mr. Takano votes aye. Ms. Adams. Ms. Adams votes aye. Mr. Saulnier. Mr. Saulnier votes aye. Mr. Norcross. Ms. Jayapal. Ms. Wild. Ms. Wild votes aye. Ms. McBath. Ms. McBath votes aye. Ms. Hayes. Ms. Hayes votes aye. Ms. Omar. Ms. Omar votes aye. Ms. Stevens. Ms. Stevens votes aye. Ms. Ledger-Fernandez. Ms. Ledger-Fernandez votes aye. Ms. Manning. Ms. Manning votes aye. Mr. Mervan. Mr. Mervan votes aye. Mr. Bowman. Mr. Bowman votes aye.
How is Mr. Comer recorded?
Mr. Comer is not recorded. Mr. Comer votes yes.
The clerk will report the tally.
Madam Chair, on this vote, there are 39 yeas and 1 nay.
The ayes have it, and the motion is agreed to. H.R. 4508 is ordered reported to the House of Representatives. Chair notes for the record that a quorum is present. I ask unanimous consent that staff be authorized to make necessary technical and conforming changes to the bill as amended. Without objection, so ordered. Pursuant to House Rule 11, Clause 2L, I give notice that all members have the requisite numbers of days to file supplemental minority, additional, or dissenting views.
Madam Chair.
Mr.
Madam-
Scott.
Madam Chair, on that, I reserve the right to submit minority views on all of the bills.
What? Without objection, so ordered. Without objection, any members who wish to insert materials into the record may do so by submitting them to the committee clerk electronically by the end of today. If there is no further business before the committee, without objection, the committee stands adjourned, and thank you again very much.